everyone, Ash here from the Physio Rooms in Woodvale, and today I'm going to talk to you about physiotherapy and pregnancy. So, as many of you may or may not know, a physiotherapist can provide a wide range of advice, education and guidance when it comes to being pregnant. Being pregnant myself, I thought what better time than now to tell you 3 of my top tips for pregnancy. So these are tips I've both used myself and I've passed on to patients, and hopefully you find them useful too. So tip number 1 is do your pelvic floor exercises. We all know how important this is. There is an abundance of evidence now showing how much doing your pelvic floor exercises during pregnancy can reduce the risk of issues such as incontinence and prolapse following pregnancy. So super important to make sure you get some guidance with these to make sure that you know how to do them correctly and in a manner that is suited to your needs. This is something you can come and see us for. So we have the real-time ultrasound machine here. We can do a trans-abdominal ultrasound, see what your pelvic floor is doing, teach you how to do them properly, and then we avoid risks that are associated with doing them incorrectly. Tip number 2 is remain active. So even though we don't want you to try something new or take up an energetic new hobby during pregnancy, we absolutely recommend keeping active. The current guidelines for pregnancy is 150 minutes of exercise per week, and this can include strength training, cardiovascular exercise, and more low intensity mobility kind of work as well. The reason this is important is that it helps prepare you for labour, it helps with recovery, it prevents issues such as back pain and pelvic pain, it reduces the risk of gestational diabetes, and it helps with things like mental health and postnatal depression risk. Now, being pregnant with twins myself, I can absolutely understand the metabolic strain that has on your body, and some days you are just going to be too fatigued to do anything else. Keep it to a gentle walk, go for a swim, try some Pilates or yoga, keep it low impact on those days. However, if you're feeling good and you want to train harder, it's perfectly safe to do some strength training to get your heart rate up within your limits, and keep active in that way. Tip number 3 is to avoid high impact exercise and excessive abdominal exercise. So high impact exercise is pretty self-explanatory. You're already carrying such an extra load on those pelvic floor muscles that sit at the bottom of your pelvis. Jumping around with things such as box jumps and double unders can have serious implications for your pelvic floor in both the short and long term, leading to things such as incontinence and prolapse. Likewise, doing too much abdominal exercise can put too much stress through the muscles that run down the front of your belly that are being stretched out and don't really have the support and control they usually do, and can increase the risk of rectus abdominis diastasis. So that's where the muscles down the front separate and the abdominal contents can bulge out. Now, this can happen anyway during pregnancy. It can't always be avoided. No doubt it'll happen to me with twins in there. However, keeping some sort of control through those abdominals and not overloading them is going to help them stretch as your belly stretches. Thanks for listening to my 3 top tips, everyone. There's an absolute abundance of advice out there for pregnancy, and this really just touches the tip of the iceberg. So if you're looking for anything extra, any advice, any guidelines, exercise prescription, whether or not you should be doing something, just call us, come in for an appointment, have a chat to our physios, get an ultrasound scan for the pelvic floor if you need to, and we can go from there. Thanks, guys.